All right. Hello, everyone on Instagram. We have the privilege of getting to hang out with Dr. Clarke today, and I cannot wait to introduce him to you. He is an incredible human being, and I just can't wait for him to share all of his goodness. Tell me where you guys are tuning in from, who's here, and what kind of symptoms do we have. There's Dr. Dave. He's waving. Dr. Dave, wave one more time if you want me to have you join on that account or the other one. You just let me know and then I'll accept the request. All right, New Jersey, Chicago, Minnesota. Awesome, you guys. Welcome, everyone. This is going to be an awesome time. Dr. Clarke it is just a blessing to be in his presence, and so I think you guys are all going to enjoy it. I will tell you at the end of this session, I am going to ask you a question, and if you DM me with the answer, I'll be giving away 2 free memberships to my inner circle. So make sure to stick around. We'll see who's listening here. All right, Dr. Clarke, if you want to send a request on the account that you want to join, and then I will make sure to accept it here. Kentucky, Iowa, someone from Idaho. Hello, everybody. All right, just waiting for him. We need one more request here. See some people waving. Hello, Leslie. Hello, Christy. Someone from North Hampshire. I love it. New England. Jamie's here. Someone from Mexico. Right. Got a little bit of everything. Kate's here. Hello, Kate. So we have Dr. Clarke speaking in the inner circle tomorrow. He's going to be the guest for our workshop, which is really exciting. He's going to be taking us through a lot of this work tomorrow, and I cannot wait to learn from him. He's someone I've followed and respected for a very long time, and so we're really excited to get to hang out with him. Okay, one more request, Dr. Clarke. Let's see. I don't think that's him. Someone else is requesting to be in the video. Let's see here. Let's see if I can find him. I'm not seeing him jump on yet. There we go. There he is. Here we go. There he is. Hello, Dr. Clarke.
Glad the technical difficulties worked out. Great to be with you. Thank you so much for having me.
I'm so glad you found us. Thank you so much for taking the time to hang out with us.
Oh, I'm looking forward to it. Thank you.
I'm going to do my best to give you a little formal introduction. I was reading your bio sometime last week, and I don't think I've ever spoken to someone with more accolades. This is incredible. You've accomplished so much in your life, and it's amazing. I'll start with Dr. Clarke is the author of, is it 3 books now, Dr. Clarke? Is there 3?
Yeah, working on two more.
Okay, so he's got a couple more coming. This is the one that I picked up most recently. They can't find anything wrong. It is an incredible read. We're reading this in the Inner Circle this month, and it just takes a very complex topic and makes it very simple and relatable, which is what I love so much about this. Dr. Clarke is also produced 3 movies, I believe.
Yeah, I was a co-producer of 3 documentary films in this field. Yeah, that was a lot of fun. I was an editorial consultant on them as well. And they're all different. All the Rage came out first, and then This Might Hurt, followed by Pain Brain, and recommend them all. You can get access at symptomatic.me, the nonprofit website.
All the Rage is amazing. I did see that one. He's also the president of the Association for how do you say that, Dr. Clarke?
For treatment of neuroplastic symptoms.
Okay, it was
easier to remember is the website we use, symptomatic.me.
Perfect. And you're also a retired GI doc too. Let's jump right into how you got into this work, how you went from being a conventionally trained, gastroenterologist to in the mind body community and kind of dedicating your life to helping people with stress
Yeah,
illness.
I had to be dragged into it, Kate. I mean, I'm the most traditionally Western trained doctor you could ever imagine. And, I was doing well in that world. I mean, I got an award for excellence in medical school. I got into my dream residency program. So the last thing I expected was to encounter a patient that I had no idea how to diagnose or treat. And that happened in year 8 of my formal training. It was a 37-year-old woman who was averaging one bowel movement per month. Just to give you an idea of how severe these neuroplastic symptoms, the brain generated symptoms, can get, as many of your circle know all
Yep.
too well.
Yep.
Well, she'd been referred to us by another university. They couldn't figure out why this was happening. She told us she was taking 4 different laxatives at double the usual doses, wasn't having any effect. She came to us at UCLA because we did some specialized testing of the neuromechanical properties of the large intestine. My department chair and I, we knew that that test was going to be abnormal because no other explanation was possible as far as we were concerned. And when that test was normal too, we were baffled. And it was left to me to do her exit interview. And I was basically telling her, you're going to have to live with this. I mean, that was the training. If it's not
Yeah.
an organ disease or structural damage, then, your pain or illness really has no good
Yeah.
explanation. And but not wanting it to be a 30-second conversation, I asked her about stress, and her life was going along fine. She didn't really have anything. So I asked her about stress earlier, thinking, maybe something happened 2 years ago when her illness began. And she said, well, my father molested me. And I had never heard that from a patient before. I had no training in what to do with that. And it's kind of embarrassing to admit that as a physician, but
Yeah.
I couldn't believe that it could possibly be connected to her illness. But I fell back on basic training for a doctor and took her story, and it turned out to be one of the most terrible histories of abuse that I heard in all the decades since then. This was back in the 1980s when I started. And I didn't know what to do with that, but there was a psychiatrist at UCLA who was certified in medicine. Her name was Harriet Kaplan. And I knew she had an interest in this. So I sent the patient off to her and forgot all about her and went back to learning how to put endoscopes into people until I ran into Harriet in an elevator 3 months later. And this turned out to be the elevator ride that changed my career because Harriet had cured this patient with less than 10 weeks of weekly counseling sessions. And that just blew my mind. I got off the elevator and I turned around and the elevator doors are closing and I'm going, Harriet, how did you do that? Because,
Yeah.
that kind of thing is not supposed to be possible.
Yeah.
But, I caught up with Harriet later and I learned everything I could from her. I wanted to be a complete doctor. And I thought, I might see another patient like this someday. I should learn how to deal with it. And she gave me a basic framework. And it turned out I was wrong on several counts. This turned out to be 5 or 6 patients a week, not 1 or 2 every so often. And there turned out not to be any Harriet Kaplans in Portland, Oregon, where I was in practice. So a lot of these patients, they got cognitive behavioral therapy, which doesn't work very well for this condition. Patients came back, said, I'm not any better. Now what? And I had this knowledge from Harriet, and I said, I don't know if I can help you, but I'll do the best I can. And it turned out these ideas are so powerful that even as a bumbling beginner, people were getting better. And professionally, that was tremendously rewarding to be able to just sit there. I'm not using my technology, and I had a lot of
Yeah.
technology I used in my practice, but I didn't have to use it. I just, had to have a conversation and some empathy and some care about listening to people's lives. And they educated me. 250, 300 patients a year. It took me 5 years probably to climb that learning curve. But by the end of that, I was feeling like I knew what I was doing and I was getting good results. And I worked for this very big organization in Portland, and they voted me Doctor of the Year award at that point. So I knew I was really onto something, and I just kept going from there.
That's amazing. And since then, you've reached the lives of and helped thousands since that. It's truly, it's amazing. I remember I found you just about the time that I was told, we can find some things wrong with you, but we don't have a solution for you. And so our solution is some antidepressants because living with chronic pain is hard. And that didn't feel like a solution at all. And that's when I started.
It's treating the symptoms, not
Yeah.
the cause.
Yeah, exactly. Exactly. So for those listening, Dr. Clarke, what kind of symptoms could you fall into that category of neuroplastic symptoms, stress related symptoms? What kind of things did you see back then and what kind of things do you see now?
Yeah, I mean, we could go through the whole list if you have another 45 minutes,
Yeah.
but it literally goes from head to
Yeah.
toe. It certainly can be chronic pain in any location, including migraines and back pain are a couple of big ones.
Yeah.
Fibromyalgia is another one. But there are a lot of non-pain symptoms too. Pseudo seizures, visual disturbances, ringing in the ears, dizziness, difficulty swallowing, temporomandibular joint stiffness, all kinds of gastrointestinal symptoms, which is how I got into this: nausea, vomiting, constipation, diarrhea, abdominal pain, pelvic pain, genital pain, bladder spasms, certain kinds of rashes, chronic fatigue in many cases, probably not every single case of
Yeah.
chronic fatigue, but a lot of them. Long
Yeah.
COVID is a big one. A lot of symptoms that are now attributed to Ehlers-Danlos syndrome, probably not from Ehlers-Danlos syndrome, but rather neuroplastic, brain generated, stress connected kinds of symptoms. And I'm sure I'm leaving a bunch out, but just, the list is almost endless. There are approximately 200 symptoms that have been attributed to long COVID. Probably almost none of those actually is from long COVID. They're
Yeah.
probably all neuroplastic, which comes from stress, trauma, unrecognized emotions, other life challenges, and they're 100% real. These are not quote unquote in your head, which is a phrase that should be
Yeah.
banned as far as I'm concerned.
Yeah.
And they can be incredibly debilitating. I've had many patients in the
Yeah.
hospital, patients with symptoms for decades. They're every bit as severe as symptoms that are generated by disease or injury.
Yeah. And how do we know, Dr. Clarke? So many people come to me and say, okay, I have this back pain. How do I know if this is stress related? How do I know if this is neuroplastic pain? This is tricky for me too, and I'm sure it is, you run into this as well, where it is important to rule out things that could be more serious, absolutely. But what we see happening is people go in, they get an MRI, they see the bulging disc, and they point to the bulging disc saying, well, no wonder you have pain. What would you say to that?
Yeah, it's true. I mean, especially in the spine, that most people over the age of 40 do have an abnormality just from the normal aging process.
Yeah.
And a lot of people under 40 also have abnormalities, just again from wear and
Yeah.
tear and aging. So it can be tricky to tell. But if you don't have evidence of nerve damage, such as muscle weakness, loss of reflexes, numbness and tingling, um, that kind of bladder and rectal problems can be from nerve compression
Yeah.
as well. If you don't have any of those, if it's just pain, not any of the nerve damage symptoms, then the chances are very high that this is neuroplastic. There was a study recently that carefully examined well over 200 people with spine pain and found that 88% of them, it was neuroplastic and not structural. So, your odds
Yeah.
just going in are very
Yeah.
high. And then, I like to do what I call a stress evaluation, assess the person for, how much stress are you under in
Yeah.
your life right now? How much stress did you have as a kid? Did you go through things that you would never want for a child of your own?
Yeah.
Is there a hidden case of depression, anxiety, or post-trauma going
Yeah.
on? And the more of those issues that I find in a person's life, then the more likely that they are contributing to the symptoms that are going on.
Yeah. And it's often, like you and I were talking about, it's often those that you know, they had a great child, a great childhood, and everything was wonderful. And they're very positive people. They appear to be happy people and healthy for the most part. Yet they have gut issues that won't quit, or chronic headaches, or whatever it is. And something you said in an interview that I thought was so powerful is when you look back on everything that you went through in your past and in your childhood, do it through the lens of, a daughter or a niece or a young,
A
child looking
child that you
back.
care about.
Exactly, a child that you care about. And it was interesting. I was kind of reflecting and going through, and it's all that we know. And so it's so easy for us to say, you know what, everything was fine. It really wasn't that bad. There were some strange things, but when you start to look through that lens, it is an entirely different perspective, and it is very eye-opening.
Yeah, I would say a majority of my patients who are affected today by the long-term impact of adversity in their childhoods, they're not fully recognizing how much they went through. So we have to have a conversation about what they experienced and compare it to how they would feel if they watched a child of their own or another child that they care about going through the same stuff. And then they can get some insight. I think we're going to go into that in a lot more detail
Yeah.
tomorrow.
Yeah.
But that's a very, very important concept. Another one I don't want to leave out is certain characteristics of the symptoms can give you a clue that they are neuroplastic or brain generated. If their symptoms are moving around, for example, moving from place to place, or if they fluctuate for no obvious reason, or if they're triggered by just light touch on the body, all of those things can be clues that they're not organ or structure based, that they're instead being generated by the brain neuroanatomy changes.
Yeah, something that a lot of people experience, something I experienced is, if you go on vacation, they can often get better or worse. It doesn't mean just because, you think of being on vacation, you're more relaxed, that symptoms would feel better as well. And sometimes they do, although you and I both know how the unconscious mind works. Sometimes the symptoms get worse. And we can kind of go into why that is, Dr. Clarke, and sort of how the brain is working to protect us from some of those painful memories and emotions that might be just lurking underneath the surface. I see this all the time with friends, just different people in my life. They'll go on vacation, conscious stress goes down, and boom, a bout of back pain or a rash or, something happening stress related. And they're thinking, this shouldn't be happening. I'm on vacation. Stress is low. Let's talk a little bit about why that happens and how common that is.
Yeah, what is coming up in your mind when you don't have your busy schedule to distract you? You're supposed to be having fun, and all of a sudden you've got the time to be thinking about issues that might be just below the surface, below the radar, that are still troubling you. This is why I say, ironically, the body is actually trying to be your friend here. Your mind is using it to communicate to you that it is in distress,
Yeah.
and it's using your body to send that message. And it's our job to try to think about what that message could be. What is it in our lives, past or present, that is distressing to us? And I've
Yeah.
also seen people who get better. One of my early patients, he had back pain every day for over 25 years, except 2 weeks out of the year. And what was he doing those 2 weeks out of the year? Was he lying on a warm beach, carefully resting his back? No, he was fly fishing in British Columbia. And he's doing this thing with the casting the rod and netting the fish and bending over to get the bait. And then he tells me when he's done fishing for the day, he's helping the lodge owner clear brush from behind the lodge. Is his back hurting when he's doing this? No, it feels
Yeah.
great.
Yeah.
Um,
It's amazing. It's so amazing. For those jumping on, what we're talking about is chronic symptoms, stress related symptoms. And like Dr. Clarke and I were saying, it is unbelievably common. We just listed off several of the most common ones, but when I'm working with people, and they've ruled out the more serious things, most chronic pain that's lasted longer than 3 months, and Dr. Clarke, you can sort of second this if you agree, and a lot of these, chronic symptoms where you can't find anything wrong, it's a gut that just there's nothing going on, but you constantly have GI, distress, bloating, these different issues. Same things with, something like recurring migraines. It is unbelievably common, and I think we're so trained to think in terms of physical. And so, we see a doctor who isn't Dr. Clarke and doesn't understand this mind body connection. And we're told that our bulging disc is the cause, or maybe it's the parasite and so often that's just not the case. I know for me, the biggest blessing in my life is just knowing that so that I don't have to spend a lifetime looking for answers in all the wrong places.
Yeah, unfortunately, to this day, healthcare professionals are taught that if you've got pain or illness, it has to be from
Yeah.
disease or injury. But there's this whole other category, which is brain generated or neuroplastic symptoms. and that comprises 20% of the adult population, 1 in 5 people, and it's 2 in 5 people that go to the doctor to get their
Yeah.
symptom checked out. So if you've got a new symptom that's not been diagnosed yet, and you go to see a doctor about it, you've got a 2 out of 5 chance that it's neuroplastic
Yeah.
right off the bat.
Yeah.
And then the more diagnostic tests you have that fail to show any structural injury or organ disease to explain it, then the probability of it being neuroplastic just goes higher
Yeah.
and higher. And it's absolutely essential at that point to evaluate the person for stress,
Yeah.
past or present.
Yeah.
And when you do that, people that you would never suspect are carrying very much stress, because my patients are actually mentally stronger than
Yeah.
average. These
Yeah.
are not neurotic, weak,
Yeah.
can't handle life kind of people. These are like Olympic
Yeah.
weightlifters of the stress world. And you can't tell from just superficial contact what they are carrying around until you ask them directly what is going on.
Yeah.
And also, what happened to you as a child that you wouldn't want for your own kid.
Yeah.
And then the stories come out.
Yeah.
And I'm sometimes only the first or second person who's ever heard this.
It's amazing. It's so amazing. So for those listening, Dr. Clarke, how is our brain, you and I talk about it, your brain is trying to help you. Your brain and body are trying to work together. It doesn't always feel helpful at the time when you end up with a headache or some type of chronic health issue, but what is causing the brain to generate these symptoms? Why is the brain what is the brain trying to protect us from by generating the pain, any type, all these symptoms that we talked about? Why is this
Yeah,
happening?
there's all kinds of different metaphors that are out there from the different writers, but I try to follow the neuroscience as closely as I can. And what we've seen happen on MRI studies of the brain is that the neuroanatomy is actually different in people with fibromyalgia or irritable bowel or what's called somatization disorder, which is very similar to this. The brain is anatomically different, so it's processing signals in a different way. And we're always getting signals from inside of our bodies. If we whack our thumb with a hammer, there's a damage to the tissue, and the signal regarding that damage goes right to the brain, and the brain has to decide, am I going to make you feel pain in this location of your thumb to help you not damage it further? And most of the time, whacking your thumb with a hammer, that's exactly what it's going to do. But let's say on another scenario, that you are running away from a bear and you sprain your ankle. Your brain is going to decide, I'm not giving you pain signal in your ankle until you get away from the bear because you need to run. So let's let you run. And once you're in a safe place, then we'll give you the pain signal for your ankle. So the brain is constantly deciding, because that's where the pain is. This pain is actually generated,
Yeah.
is in your brain. And if you've been through trauma or stress, or you have emotions that are getting repressed, it can make a signal of pain anywhere in your body or other symptoms in response to that. So that's really what's going on. You get the physical aspect of the emotion, for example, without the conscious awareness of the emotion.
Yeah.
Let me take 1 second longer to elaborate on that. Most emotions are accompanied by some kind of physical reaction. If you're embarrassed, you often get redness in your face. If you're in a tense situation, you may feel a knot in your abdomen. But if you're not consciously aware of the emotion, you can still get the physical reaction. And then you start to worry, what's going on in my body here? You can become afraid. The fear then ramps up the physical
Yeah.
symptom, and you're into a vicious cycle that can result in an illness.
Yeah. Yeah. And just understanding too that our brains perceive our traumas, the memories of those traumas, our repressed emotions as a threat to our safety. And so often sends some pain or a rash or some type of physical symptom to, hey, look over here. Let's just stay focused on this physical aspect. And then you won't be so aware, like you talk about being on vacation, you won't be aware of what might be lurking under the surface and just about to come out into the open. And that to me is, once you understand that, now you can kind of partner with your body and say, okay, I see what's happening here, and you can take your
Yes.
attention off of the physical symptom, which for me really helped with, as long as I was focused on the physical aspect, the symptom, how annoying it was, how painful it was, how frustrated, as soon as I could take my focus off of that and onto my emotional health, onto my, really focusing on that, it took the power away. The symptoms started to dissolve, and it was really nice. So when you finally experience that, it's empowering because you can understand, you see how your brain and body are working together, and now you're in the driver's seat, which is a good,
Yeah.
good feeling.
Yeah, you're partnering with your body and letting your body communicate with you so you can go after the real
Yeah,
causes. And
yeah,
the real causes are almost always treatable.
yeah,
Sometimes it takes a while. I mean, some of my patients have needed years of psychotherapy to achieve a good outcome, but other people, it's just a light bulb
yeah.
moment. The first story in the book, They Can't Find Anything Wrong, is a patient who was hospitalized at a prestigious university 60 times in 15 years with no diagnosis. They even had a psychiatrist evaluate her, and he completely missed what was going
Yeah.
on. She was completely cured in less than an hour by uncovering what the stress was that was triggering her attacks of severe dizziness and vomiting.
Mhm.
Just made the connection with the stress. She saw it, the light bulb moment
Yeah.
happened, and she never had another
Yeah.
episode.
Yeah. How does that happen, Dr. Clark? I always like to remind, the people that I'm working with that yes, it can take some time to calm the nervous system and to heal and to, work through some of these traumas. But myself, and I have seen so many others, once they uncover what it is, once they turn toward and feel that emotion and signal that safety to the brain, healing can happen unbelievably quick. I mean, it's amazing. Can you talk a little bit about how that happens and how we can, all of a sudden, the volume on the pain or the symptom is just turned off in some cases or way down in others?
Yeah, it is. It is amazing to see it. So many of my patients have healed in a matter of weeks or months. Not wish I could claim to do it in an hour like that one patient, but you know, some of these patients have been ill for years or decades, and to see them turn things around in a fairly short space of time doesn't mean everybody's going to do it, but some people definitely can. And the brain is physically changing. The Boulder back pain study, which had 150 people with an average of 10 years of back pain. One third of those subjects got the pain relief psychotherapy, and they scanned their brains before and after they got the pain relief psychotherapy, and their brains physically changed.
It's amazing.
There was an actual anatomic difference from the psychotherapy. So that's really what's going on. But the insight that people get, the whole change in mindset from my body is
Yeah.
damaged to my body is trying to tell me
Yeah.
something. It's night and day difference in how people are thinking about this, and leads to relief.
Yeah, it does. And if you can partner with your body in that way, then it's like you said, there's that, at least there's not that constant threat of like, why is this happening to me? What is happening? Once you understand, it just brings so much peace and safety into the equation, just knowing that that's how the brain and the body are supposed to work together. So if we understand, and I think there's so many people in my community that are fully on board with the fact that yes, chronic stress is contributing and maybe having caused all of these health issues that they're experiencing. Um, there's so many different forms of stress, Dr. Clark, and you talk about 5 in your book. Can you kind of help us narrow that down and where we might focus? I know, again, we have a lot of people here who, I had a great childhood, or I don't know what it is. Yes, I had some trauma, but how do you even go about figuring out what it is that you need to process?
Yeah, well, for people that have had symptoms for longer than a year, certainly longer than 2 years, people with multiple symptoms, people with severe symptoms, debilitating symptoms, the worse it is, the longer it's going on, the more symptoms there are, the more likely we're going to find the roots of this in adversity in a person's childhood. And part of the reason is that they may not see the reality of what they experienced. I can give one example. I get some interesting consultations in this field, and one of them was a person who's known to the public. Frankly, I won't say who it was, but I was meeting with this person in a bar in Beverly Hills, of all places. Not my usual examination room, but um, she had had half a dozen neuroplastic symptoms for 20 years. And she's, in her late 30s at the time that I'm talking to her. And she, we went back to talk about her childhood. And what happened was her parents verbally and emotionally abused each other on a daily basis. They didn't physically fight, they didn't hit each other, throw things at each other, but the verbal and emotional violence was there almost every day. She was the only child, she was the peacemaker, and she had that burden, from a very young age. But she was telling me, up and down, this was not that bad. I wasn't abused. Other people have been through much worse than me. My parents cared about me. And yet, this was going on between the parents all the time. Age 8, the parents divorced. So you'd think, okay, finally, a solution. But no, the parents continued to live in the same house. They slept in separate bedrooms, but they were still living there. They were still at each other. And there was, from her perspective, no improvement. And it goes on like that until she finally leaves for university at age 18. But she just could not see that this was much of a burden for her. There was no other significant stress in her life. So the solution for her was that she had a beloved niece, 5, 6 years old. Lived in the same city with this niece, would take her for the weekends, would take her shopping, would take her to amusement parks and to the movies, just absolutely adored this little girl. So I said, all right, we are going to have you imagine that your beloved niece is in the household with your parents, trying to deal with them, and you are just a butterfly on the wall of your childhood home, and you are having to watch this go on, and you can't do anything about it. All you can do is watch. And let's say this goes on for a week. How are you going to be at the end of that week? And she just stared at me.
Yeah.
Very verbal person. Just stopped talking and just processed that. And after a couple of minutes, which was a long time for her to be silent, she said, at the end of that week, I would shoot myself. And that was the first time that she realized just how much of an impact it really had.
That is,
This is one of my exercises for your group tomorrow, Kate.
I
So I
love
don't
this
want to get
exercise.
ahead
It's
of
so,
myself here, but
yeah,
it changed her
it's
life, that insight.
it's unbelievably powerful. I have done so much work and different kinds of therapies and teach this stuff. And when I heard you talk about that on the podcast I was listening to and sort of walk through the exercise myself, it was unbelievably powerful. Even as someone who understands the importance of this work and has a lot of self-awareness and is very aware of the things that happened in my childhood, when you step back and look through that different lens, you'll understand how much you had to cope. Right? We had to say, like, it really wasn't that bad, or that's a way that we cope. It's how we get through those hard things too, to diminish them and to just make them, and it's also all that we know, when
We
that's
don't
all that
have a
you know.
parallel life
Yeah.
to compare ourselves with.
Yeah.
Yeah. No, you have tremendous insight into this, Kate. The people who work with you and read your posts are very fortunate because your empathy skills are top
No,
notch.
thank you so much. It's just been so fun to be able to take my own pain and suffering and be able to either prevent others from having to walk the path that I did, or the ones that are already on the path, to be able to give them, go this way, don't go this way. Because I certainly went the wrong direction for a long period of time. But I was telling, it was my New You program yesterday, and it was our last live, and we're wrapping it up, and I was just saying, the greatest gift that I found in my life when it comes to, navigating life and health is just understanding that this is how our bodies communicate. And once you understand that and you know how not to fuel a symptom, we were talking about when you get a headache, when you have a bad night's sleep, when you have some GI distress, when something pops up, if it scares you, and it steals your focus and attention, and you start trying to solve it and think about it. And for me, that's what kept me suffering for years, because I just thought, well, was it something I'm an analytical person, I want to know why, and I'm thinking these things through. But the more I would focus on the physical aspect, the worse it would get, or the longer it would last. And so when we just understand that sometimes these things just happen in our bodies, and oftentimes if they last longer than 3 months, this is now a neuroplastic thing, which is, as
Right.
we know, our body and brain's way of really trying to distract us from a lot of this stuff that's under the surface. You talked about a little bit in a podcast that I listened to about certain personality traits and tendencies, sort of making us more prone to, these stress-related symptoms. Can we talk a little bit about what those are? It's for those listening, it's such a gift to know where you're generating tension in your life, because if you understand, oh, I'm a perfectionist or I'm a people pleaser, whatever it is, you know exactly where you need to go to be able to process some of that stuff, which immediately, creates more capacity in the nervous system. It's amazing how powerful just understanding where you might be generating tension in your life and what you could do about it.
Yeah, that's going to be a big topic for our session
It's a good
tomorrow.
one.
But a lot of people who come from challenging childhood environments, one of the things that suffers is their self-esteem, their belief in themselves as worthwhile human beings. They can feel like they're not measuring up, or they're second rate, or they're utterly worthless, depending on the experience they had. And I try in my treatment very fundamentally to help people turn that around and recognize that that's an assumption they have absorbed about themselves that is completely false, and that actually the opposite is the truth. And if they can come to recognize that, and we'll talk about that in more detail with exercises tomorrow, then a lot of ripple effects that are positive in their lives will
Yeah.
follow from that.
Yeah.
The way they think about themselves, their ability to take care of their own needs, their ability to set boundaries around toxic relationships. That patient I mentioned earlier, who had the battling parents, once she realized the magnitude of what she'd overcome, and it helped, the corollary to that is to uh, boost her own
Yeah.
self-esteem as somebody who had heroic
Yeah.
perseverance to get through all that.
Yeah.
And it gave her such a more positive view of herself that she got out of a toxic relationship the next day.
It's amazing. It just snowballs. And like you said, when we're going through life, sort of viewing everything through that lens of inadequacy or I'm not enough, that alone is enough to create the constant perceived threat. There's this constant attack. You're not enough. You're not smart enough. You're not successful. All of these things that we tell ourselves. And like you said, if we don't recognize that core wound that probably happened a very long time ago, well, then we're going to be walking through every experience in our life looking through the lens of I'm not enough. And
Yeah.
it's devastating to
Puts
watch.
you
Yeah.
on a treadmill that you almost can't ever get
Yeah.
off. And you're constantly working to prove yourself to others and solve everybody else's
Yeah.
problems. And you never end up putting yourself on the list
Yeah.
of people you take care of.
Yeah. Exactly. It's so true. So, Dr. Clarke, for those listening, when we understand, okay, this is stress, and your experience working with people, is it enough to go back and, are they journaling? Are they talking? What do you feel is most effective as far as what is happening when we go back and we uncover those moments? There's some questions here coming in like, well, okay, we understand it could be a trauma. Explain what happens to your clients that you're working with. Are they telling you something? Are they journaling? What's happening?
Well, they're definitely telling me the story, and I'm reflecting back to them what I'm hearing when they tell me the story, and trying to help them see that the magnitude of what they experienced is probably a lot bigger than they think. And once they can truly appreciate just how, an analogy that I use is that many of my patients were essentially dropped by parachute into the Himalayas as toddlers, and they had to find their own way out. And the fact that they did that is remarkable,
Yeah.
and they have to give themselves credit for doing that. And that begins a full flip in their self-image. And they can journal about that.
Yeah.
There are various writing
Yeah.
exercises. I mean, we can go
Yeah.
through tomorrow's program
Yeah.
if you want, but
Yeah.
there are lots of ways
Yeah.
to, we can't go back and change the past. We can't, if you suffered adversity as a kid, we can't change that. but we can absolutely change the long-term impacts. And there are several different dimensions of that, all of which can be addressed.
It's amazing. And even just acknowledging, like you said, and validating and just no longer minimizing what you went through is so powerful. And just that, like you said, partnering with yourself and moving forward and being proud of yourself for everything that you endured and went through. It's such a different experience than, oh, it was fine. It really wasn't that hard. It's like, uh-oh.
Yeah, no, I want everybody who's watching to um, have hope that this situation can be turned around, no matter how bad it looks. Because again, I've had patients who've suffered from this for
Yeah.
decades, with the person in the hospital on morphine around the clock. All of these people got better
Yeah.
using this approach.
Yeah. Let's talk about some of those symptoms, Dr. Clarke, before we wrap this up. What kind of, so are we talking back pain? What have you seen? You mentioned somebody on morphine. I mean, severe pain, severe conditions. I mean, it's amazing how severe this stuff can be.
Yeah, it's I didn't believe it at first. You know, one bowel movement a
Yeah.
day on 4 different laxatives.
Yeah.
I mean, that's the brain can do
Yeah.
that. Another patient of mine, completely paralyzed stomach, the organ of the stomach, not the belly, completely paralyzed. You know, we scanned him after he took some, you know, slightly radioactive tracer, and the stuff just sat there. Didn't move at all. They called me from the lab down there and said, "Hey, we've been scanning him for 2 hours and nothing has moved. How much longer do you want us to scan him?" And I said, "No, we're done.
Yeah.
We have proven that his stomach is not empty."
Yeah.
And that was 100% from stress, because we found the stress, we treated it successfully, and all of his symptoms went away. Another patient of mine, 55 years of abdominal pain. Uh, Saw him back in the days of paper charts. It was 3 inches thick, and that was just volume 3. He had 2 other volumes somewhere
Yeah.
back in the stacks of the medical
Yeah.
records, just full of treatments that had been tried and tests that had been normal. And he was completely well in 30 days. So there's tremendous hope, and the level of severity of the symptoms, you have to have your viewers come in to see symptomatic.me, this video
Yeah.
that we have on there. It was produced by a Hollywood film director, feature film director, who was had chronic fatigue for over a year. All she could do was crawl from bed to bathroom and back. That was all she could manage all day, for over a year, and made a full recovery using these methods, and was just so enthusiastic she wanted to make a video for us. And it's only 7 minutes long. It's
Oh,
absolutely
I will
incredible.
share that video. I did see that video. It is so powerful. And it just leaves you with the truth, which is that there is so much hope. There's so many people out there, Dr. Clarke, you know of them, I know of them, I see them in my community all the time, who are suffering unnecessarily. And it's just, I know it's such a passion of yours to spread this message, and mine as well, because we've got such an epidemic of, you can think of it as an epidemic of health issues or an epidemic of fear and unresolved pain, like it's really,
Yeah,
that's really what's at the
you
bottom
know,
of all it.
and it's a social
Yeah.
injustice that people are not getting the care they deserve. I mean, somebody with back pain from a pinched nerve, they're going to get,
Yeah.
very appropriate care from our healthcare system. Somebody with exactly the same pain from a neuroplastic brain generated process, they're going to get terrible care
Yeah.
in our system.
Yeah.
Nobody's going to talk to them about the stresses. Well, almost nobody. We've got hundreds of people in our organization now that will talk to you about this and will successfully treat you. But, hundreds of skilled practitioners versus 50 million suffering patients in the United States alone is not nearly enough.
No, it's not. It's just not. Thank you so much for what you do too. I mean, I was telling my community, I found you, it must have been 8 or 9 years ago, and I have just had so much respect for what you're doing to spread this message. There's a lot of people like myself that are, we're working and we're doing programs and classes, but you're out there, on different TV shows. And I mean, it's just really helping get this message out. And it's such an important one to get out there. I'm so grateful for what you do.
Thank you for all you do as well, Kate.
Years, of course, of course. Someone's asking what the book was. So I want to make sure everyone saw this.
Yeah, it's It's actually a little bit mirror
Is it that?
flipped there, but um, it's that
They,
they can't find anything wrong. It's basically 4 dozen or so stories to illustrate the spectrum of different kinds of stresses. Try to make it very
it's
non-technical.
it's such an easy read, Dr. Clarke, and there's so many practical tips in there as well, which is what I love. Speaking of the practical tips, for anyone who wants to learn how to do this work, Dr. Clarke has such a gift in guiding people through that process of here's an exercise, here's maybe where to look so that you can uncover what just might be holding you back from healing. So we're going to be doing that tomorrow in the Inner Circle workshop. Dr. Clarke, do you have time for a couple questions? I'm seeing a couple come through here. My community doesn't get to ask doctors that understand this work questions very
I have
often. Um,
15 whole minutes till my next meeting
perfect.
date.
That's perfect. We'll let you go in 5 minutes. I just saw a couple come through. Someone asked about autoimmune. I'll let you answer that one.
Yeah, technically, autoimmune is not neuroplastic, but there is research evidence that your risk for getting an autoimmune disease is higher if you've had adverse childhood experiences.
Yeah,
So there is that link there, and there's also the possibility that yes, some of your symptoms are due to an autoimmune disease, but you can have a neuroplastic condition at the
yeah,
same time. And starting off right off the bat, it can be difficult to decide what the relative contribution
yeah,
is. Is it 80% autoimmune and 20%
yeah,
neuroplastic,
yeah,
or is it the other way
yeah,
around? And oftentimes the only way is to assess somebody for all the stresses that are going on, treat those stresses because they deserve it for their own sake, and then see, do the physical symptoms
yeah.
improve?
And they often do. I just recently had somebody in my one of my programs who reversed all of her autoimmune markers, and no matter if it's cancer, some of these symptoms that might be a little bit more out of the realm of neuroplastic, you can't, the mind and the body, you can't separate the two of them. And so when you work with both, when the nervous system comes into balance, the immune system comes back online, it's amazing what can happen. I mean, it's
Yeah.
the
Oh, I
sky's the
would
limit.
love to see a study someday where we do neuroplastic psychotherapy for people who have these autoimmune conditions, and then see, what happens
Yeah,
to their condition over time.
yeah,
Does it improve? Does it at least not get worse as quickly as it might have otherwise? I would love an answer, a scientific answer to that
yeah.
question.
I think we'll probably be looking into that in the future, just because we understanding too that when the nervous system comes into balance and spends more time in rest and repair, it's amazing what the body can do to heal. The body wants to heal. Someone's asking about sharp chest pains and having ruled everything else out. Is that
Oh
common?
yeah, it can be from muscle spasm of the esophagus, can give you sharp chest pains that are not related to heart disease, for example. And that absolutely can be neuroplastic.
Yeah. Dr. Clarke, thank you so much for taking the time to come on and share with us. Again, I'm just so grateful for what you do. And way back when were curious about what was going on with that patient of yours, and for you to care enough to say, I don't have the answers, but how did you get better? And to be curious enough to look into this and close your practice and help so many people says so much about the person that you are.
Thank you. Yeah, it really shouldn't matter what's causing the symptoms. We should try to give the best quality care to everybody, no matter what's causing their
Yeah.
symptoms, neuroplastic, organ
Yeah.
disease, structural damage. It's the socially just thing to
Yeah.
do.
It is. Thank you so much.